Okay.
Can you introduce yourself and tell us what you do?
My name is Emily, and I am an ICU nurse.
Okay, so what would you say the most challenging or rewarding parts of your job are?
I'd say the most challenging, especially being someone who's just graduated and is in a high intensity setting, would just be, you know, knowing that this person's life is in your hands and that you're giving them, some dangerous medications that you have to be careful about and just double checking everything, but just knowing that you have that responsibility, that can be challenging sometimes.
Yeah, definitely. And then rewarding?
The most rewarding thing would be, seeing patients who have been here for a while and patients that you've had consistently over the time that they've been in the hospital and seeing them improve, seeing when they came in and how they were at their baseline and then how they are after they're getting their treatments and getting better and just their improvement.
Cool. Okay. And so, what part of your job would you say is nutrition related?
I think we deal with nutrition every day. We have a dietitian that rounds on our patients every day. A lot of our patients can't eat for various reasons, so they have feeding tubes. We have special formulas for each patient based on their diet. We have renal, one for diabetes, a fiber one. We have all these things, and then certain medications have, an effect on your nutrition. Like a lot
Mm-hmm.
are fat soluble, so we have to substitute with protein, and it's all very nutrition based. Like especially in the ICU, we have nutrition that we can give through the IV, and that's changed. The formula's changed every day based on the patient's labs. And I think a lot of it's nutrition based. Most of our patients can't decide what they want to eat because they have these special restrictions, and you have to work with family and tell them not to bring in the McDonald's or the fast food because it's not good
Mm-hmm.
for them, and you have to really explain and fight for them to get better, and nutrition is such a big part of that.
Yeah, definitely. And how many nutrition related education classes did you have to take before becoming a registered nurse?
I only had to take one, and
Mm-hmm.
it was in my prereqs. It was a decent class. I don't remember a whole lot from it. I think growing up, I had a pretty good base of what nutrition was. It was more of a scientific related thing, more than one that I could apply. Like I think it was more based on the biology part of it rather than
Yeah.
how it would apply it to like patient care and stuff.
Mm-hmm.
I'm trying to think, in nursing school, we didn't really have a nutrition class. When we would go through things like diabetes and stuff, they would go through the nutrition related to that.
Yeah.
Um, but besides that, no, I've had one meeting with the dietitian as an orientation as a new grad at the hospital, and that was interesting. But no, there's not really a whole lot of nutrition based classes.
Okay. And how would you say the nutrition of your patients affects your work?
Well, almost all of the patients that come in have type 2 diabetes. I mean, it's almost an anomaly if they don't. And, we see them continue to eat things that aren't good for them. And it's hard too because some patients, especially if they're older and they can't really eat a lot or they're not hungry, like their nutrition is limited. So, if I have a old lady who hasn't eaten anything in 3 days and all she wants is some pudding, like I'm going to give her the pudding because I need her to eat. And I think that's the hardest thing, like, wanting to have good nutrition for your patients, but also knowing that in the end it's up to them and they're going to be the ones who determine what they want to eat.
Yeah.
So, we can educate and try and steer them in the right direction, but ultimately it's up to them.
Yeah, absolutely. Okay, thank you.